Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Fred Venditti, our hospital system general director. This is the update from Albany Medical Center on the coronavirus. Today is Incident Command Day 47. In the 5 counties, Albany, Rensselaer, Saratoga, Columbia, and Schenectady, we have 1,822 people who have tested positive for COVID-19. Over the last 2 days, that's increased by about 4% per day. I think, Fred, next week we're maybe start comparing those numbers to some of the flu numbers that we've seen in this past season, since flu season has just come down.
I think that'd be very interesting, Dennis. So give context.
Give some context to that. Inside here in the medical center, we currently have 55 people with COVID-19. We have 33 on the floor. We have 22 in the ICU. We have the same number who are on ventilators, which is 12. Yesterday, we had about the same number that came in as were discharged, and we actually discharged 3 people down to New York City. We're sad to report that we did have 1 death. On the ventilators, I'd like to talk a little bit more about that. Fred, how long do people remain on a ventilator on average when we put them on a ventilator?
So the patients that we currently have on ventilators, Dennis, have been on for quite some time. On average, it's about 17 days now. For those patients that we've been able to extubate, it's more like 10 days. So we've been able to take 30 people off ventilators, and that's the length of time they were on.
30 people off ventilators?
30 people off ventilators. Total of 62 people on ventilators through the course of our last couple of weeks.
Speaking of ventilators, we mentioned that we were now having some circumstances where we could take the ventilator and move it outside the room so that the respiratory therapists and the critical care doctors could safely make adjustments to the ventilators while still observing the patient through glass. We had mentioned the other day we'd done that with our first patient, and now we can report we've done that with 6 patients. So this is an improvement, and we'll continue to do more of that in the next couple of days.
That's terrific.
Fred, any update on convalescent plasma?
So Dennis, we've, as we said yesterday, we've transfused 24 patients with convalescent plasma. I think we have 4 more ready to go. Someone asked a question about what exactly is in plasma. Plasma is just the liquid pretty much in the blood. And the proteins, no cells like lymphocytes or any other kinds of red cells, etc. in there. But that's what convalescent plasma is.
Thank you, Fred. Speaking of convalescent plasma, that makes us think about the speed in which we get results back on whether or not people have had COVID-19. And some people have asked about how quickly those results are coming back.
Right, Dennis. So right now we're using PCR testing for the COVID tests that we have to do prior to determining if someone is a candidate, and that takes about 24 hours. Soon we're going to have a quicker test that will allow us to process faster. In terms of the serologic testing that we do on the patients, where we actually measure the amount of antibodies, that's different than our normal labs. With normal labs, frequently have to fast so that the blood is not lipemic. With this particular test, you don't have to do that, so we can turn those around pretty quickly.
Okay, thank you. As we mentioned on Friday, we like to end on some good news stories. Let's jump through a bunch of those. In the practice, we continue to offer telephone visits to people who would like to be able to connect with their doctor here at the medical center, but do so over the phone. So far, the practice has offered telephone visits to 18,000 people, which is remarkable. We also have video offering at now 42 different practice locations, and we've completed 2,600 video visits. We mentioned last time that if you're somebody who would like to access one of our physicians in the practice through a video visit, you would do that through the portal, and we'll put the website up there so that you can access that through the portal. We'd like to call out medicine, neurosurgery, psychology, psychiatry, and urology as some of the clinics that have really been knocking it out of the park.
Hundreds of them. It's great.
Our employee health service currently is located in the evening hours and on the weekend on M411. We're going to move that location starting Monday from 7 a.m. to 7 p.m., 7 days a week. It'll now be on F as in Frank, 217. So new location for our employee health service. That'll be for COVID-19 testing for our employees.
Right, just for those specific tests.
We mentioned just 1 week ago that we were going to have an opportunity for members of our workforce to donate some of the time that they have earned into a pool or a bank that other AMC employees could draw down upon if they had a life circumstance that required them to take some days related to COVID-19, like a family member, for example, who might be sick, or they themselves who had to go home waiting a test result. Fred, our workforce is incredibly generous. I'm not surprised at all how quickly they've responded.
They are. They have donated 410 days. 46 of our employees have donated 410 days. That's just tremendous, absolutely tremendous.
And that's just 1 week.
That's just 1 week.
Yesterday, I had the great opportunity to go out to a location where the face shields that I spoke about last week are being made. You will recall the Center for Disability Services and the New York State Industry for the Disabled were getting together and they were making face shields for us. I had the great opportunity to go and meet Dr. Eric Ledette. He is a professor of biomedical engineering at RPI. And he and his graduate students were showing me how they had designed them and they'd put them together. And I had a chance to go out to the Life Quality Solutions Incubator. They did a great job. They did a great job.
We're very appreciative.
So and thank you to RPI for the great work there as well. If you've not been in Choices Cafe recently, you may not know this, but now we have an opportunity, if you're a member of our workforce, to pick up some convenience store items there to maybe save you from having to stop on the way home and pick up things. So I think we have milk, peanut butter, jelly, eggs, bacon.
And toilet paper.
Toilet paper, paper towels.
And paper towels.
So
all life's necessities.
These are just another little offering we're giving to our workforce to make things a little bit easier for them as they're leaving work and save them maybe a trip on the way home.
It's
so if
fantastic.
you haven't had a chance, go by there. And speaking of purchasing things, we spoke about the T-shirts, the AMC Strong T-shirts that we showed earlier in the week. Today, we had a new batch come in, and we sold out 500 of them in just 45 minutes. The workforce loves them.
It's incredible. We were actually watching the video of this. The line was out onto the bridge from the gift shop.
And we think we have another 1,000 of them coming in next week. So if you didn't get yours today, don't worry. You'll have another chance next week. Speaking of shirts, we're wearing shirts today for Lab Admin. We mentioned it's Lab Week, and we recognize the great work that our lab has done over the whole COVID-19 pandemic.
That's right. So the laboratory services that we're sort of honoring today, the chemistry lab, hematology lab, the histopathology lab, that's a group that you might not be familiar with. They prepare specimens in formalin for our pathologists to look at under microscopes. They all do a terrific job. Thank you for all your hard work.
I definitely second that. They do tremendous work, and we thank them for all that they're doing. So as we go into the weekend, we know that some people might be out there volunteering. Next week, we're going to talk a little bit more about not only how the community has responded to us, but how our workforce is responding back in the community. If you happen to be out volunteering this weekend and you have a chance to put on some of your AMC gear, take a picture, and next week we're going to talk a little bit more about that and maybe show you some of the good work that our workforce is doing out in the community. And like I said, we'll talk about the flu numbers as well next week.
Great.
So that's next week. Okay, so we'll continue to be working here on this weekend. We hope that you can have a relaxing and enjoyable weekend if that's something that is in your future. We ask that you please take care of yourself, take care of each other, and we'll see you on Monday.